So I'm at ASH right now. It's a very exciting time for us. I'm Pinkal Desai from Weill Cornell Medicine program, and I specialize in leukemia. We're very excited to present our data that we just presented right now. We found at the Weill Cornell clinical and translational program that participants in a cohort that we studied had a higher chance of having mutations at baseline years before developing AML compared to people who did not develop AML. So we had like over 200 cases of AML and 200 controls where we found that people who had mutations at baseline, that was like 10 years before the actual diagnosis of AML, were 4 times more likely to develop AML compared to who did not harbor a mutation. This is very important because we know that having a mutation confers some high risk of having a heme malignancy down the line, but that relationship was actually not established for patients with AML. And the specific relationship of what mutation confers how much risk was also not established. And we were able to demonstrate that the risk is different based on the mutation you have. So if a participant were to have a TP53 mutation, for example, everybody in our cohort developed AML. And people who had IDH mutation, almost everybody developed AML except for one participant who did not develop AML. And it's very high impact because we've been talking about at ASH, and there have been so many sessions on this, that how do we monitor these people? That we know they have mutations, we don't know when or if they will get AML, and we provide data to suggest that if you have this particular mutation, your risk is different, and that if your frequency of mutation in the blood is climbing, then you might get AML sooner than somebody who has a stable mutation over time. And I think this is very important in terms of developing a monitoring strategy for a lot of patients, because we know that people who, for example, get chemotherapy, they're at higher risk of developing AML, and we just didn't have enough data to suggest how we monitor, who to monitor, and if we are almost sure that AML will happen in some of these participants, perhaps there might be some role of developing an intervention strategy. We're far away from there, but I think we've taken the first step to at least establish that people can be monitored and we can achieve statistical odds high enough that you would worry about AML happening. And this work was done in great collaboration with Dwayne Hassani, who is our genomics leader at Weill Cornell leukemia program, and we're very excited about our work.